So welcome everyone. We're so excited to have you all here. My name is Desiree Licky. I am the program coordinator here at the North Carolina Office of Violence Prevention, and we're excited to have you join us for our webinar on the public health approach to violence prevention. Just to go over our agenda really quickly, we'll do a couple of introductions. We'll go over some housekeeping tools or tips. We'll have a brief welcome from our OVP leadership. Dr. Young will go over her presentation, and then we'll have about 10 minutes or so to go through a Q&A with our speaker, and then we'll do a brief closing. A couple housekeeping tips. So you'll notice that everyone's camera or all the attendees are cameras are off and mics are muted. This is intentional to keep the focus on our speaker today. So if you have any questions specific to the presentation, we ask that you put those questions specifically in the Q&A. So that's going to be on the bottom right-hand section of your screen. You'll see those three little dots on the right. And if you click those, then you should see the Q&A. And so that's where we want specific presentation questions there. And then any other questions you have, if you can't hear us or you want to make comments or share anything else, if you could put that in the chat there, so that way we can kind of keep those separate specifically for the Q&A session. So it's just easier for us to kind of field those questions. Also, our webinar is being recorded, so we will be posting this on our website within about a week. So if any of your colleagues weren't able to make it, or maybe you want to rewatch the content, you'll be able to do that. And so now I'm going to pass it over to our director, Ciara Scott.
Thanks, Desiree. Good morning and welcome everyone. Thank you so much for joining us today. I wanted to, thank you for taking the time out to join our webinar, but also provide a little bit of background context about our office. So for those who are not familiar, NCOVP is a newer office in our state government, and we are housed at the Department of Public Safety and supported through close partnership with our colleagues at the Department of Health and Human Services. And when our office was established, we were tasked with working to coordinate efforts across the state to reduce violence, harm from violence, and firearm misuse. And although that mission is broad to all forms of violence, we are starting our efforts on narrowing in on community violence. And so that's the focus area for our office at this current moment. And so we work towards that mission by really centering the public health approach and engaging in cross-sector collaboration, supporting local communities, and helping them deploy evidence-based programs and strategies. And so last fall, we released our Community Violence Prevention Strategic Plan, which was developed in collaboration with our advisory board and various partners. And this plan is centered around three primary goals that will really guide our office's efforts around supporting and enabling community violence prevention work across the state. And right now we're in the implementation phase of moving forward this plan. But I wanted to call out that one objective that we outlined in this plan under our third goal is to enhance understanding and use of the public health approach. And so with the public health approach really being at the core of our office's method towards addressing and preventing violence, and with it being a priority objective in our strategic plan, it made sense to us to make this the topic for our very first webinar. And this will likely be one of the first of what we hope to be many learning opportunities from our office on this topic. And so without further ado, I'd love to introduce you all to today's speaker, a great colleague and friend of mine, Dr. Belinda Rose Young. So Dr. Young is the Managing Director of the Training and Education, or Managing Director of Training and Education at the UNC Injury Prevention Research Center. And she is also an adjunct professor at the UNC Gilling School of Global Public Health. And her work focuses on helping county and state leaders prevent adverse childhood experiences, sexual violence, and human trafficking. And she has been featured within publications from sources like the Washington Post, NPR, Newsweek, and the United Nations, and several other global newspapers and outlets. And she has also served as an advisor and thought leader on multiple national nonprofit boards and research committees. And so with that, I'd like to welcome Dr. Young, and I'll pass it over to you to get us started.
Thank you so much, Director Scott, for inviting me here today. So as I'm bringing up slides, I want to hear from you. You heard a little bit about me. I want to hear from you in the chat. Tell me where you're coming from. Are you coming from North Carolina? Um, if you're not, let me know your state if you're not in North Carolina, I'd love to know your role, your title, what you're doing. I want to know who I'm talking to. The more information I have, the more I can tailor to you. Fort Worth, welcome, Texas. All right, who else do we have in the chat? Ooh, public health nurse, love it. RTI is coming in quick. Love it. Oh my gosh, thank you so much for giving your time. Look, I am not one to take time for granted. As a mom of a little one, time is precious. Wisconsin in the house, love it. Take a couple more. Wow, I'm seeing a couple public health nurses loving it. I see that office. Welcome. Welcome, welcome. All right, well, I will keep reading that as we go through. We're going to jump in and we are hopefully going to have a good time talking about the public health approach. So I am speaking to colleagues here. A lot of you are already in this space. You're already doing violence prevention work or response. And so I'm sure what I have on this slide is not too startling. Violence is common. It's common. It includes many types. Dr. Scott or Director Scott mentioned some of the ones that I do in terms of ACEs and human trafficking and sexual violence. I see some of you and other work tackling different violence types like domestic violence, et cetera. So there's a lot of different types of violence, right? So some of the stats here, 41% of women, 23% of men have experienced sexual violence. Again, that's my area. The violence is a leading cause of death amongst young people, and this has been a trend since 1981. It has been in the top 5 since 1981, sometimes in the top 3. And per CDC reporting, 1 in 5 high school students have seen someone physically attacked, beaten, stabbed, or shot in their neighborhood. Speaking more to the community violence work that I know some of you guys do and the OBP is centering on. Within our own state of North Carolina, definitely welcome Wisconsin, Texas, others, but within our own state, 5 people a day die from firearm injury. 5 people a day die from firearms. And suicide is the leading cause of death, of violent death in North Carolina, which is consistent with some other states as well. What was pretty startling to me is the YRBS Youth Risk Behavioral Survey that CEC implements. In 2021, we found in North Carolina that 30% of our high school students said that within an hour, they could have access to a loaded gun and be ready to fire without their parents knowing, without their parents' permission. This is where we are right now. So some of you guys could be up here talking about this just as much as me. We know that violence affects us in a lot of different ways. It affects us physically, it affects us emotionally, mentally, and socially. And one of the things that I know I try to disrupt is the generational effects of generational effects of violence, those repeated cycles of violence and trauma. So we know that violence is common, it's pervasive, it has a lot of negative effects, as we see on the slide here. So what do we do about it? I know I'm speaking to many colleagues, maybe there's some students here as well, they're learning, what do we do about it? Well, we need a structured approach. I know sometimes we just do what we can, or we do what's always been done, but the reality is we need a structured approach to deal with an issue that's so widespread and common, and there's so many things that feed into it. So we need something that is repeatable. You know, if we think back to elementary school or middle school, maybe you did a science experiment with lava. I know for us, we made ice cream. I don't know what you might have done in your middle school, but we need something like the scientific method, right? Something that is simple, it's structured, it's repeatable, so other people can implement as well. So structure provides clarity. It provides directions. We know what step 1 is, we know what step 4 is, right? It also helps us better spend our money and resources, especially if we are struggling for resources, if resources are cut off or shifted, we need a better way to spend our money and to be more thoughtful about how we're spending our not just money resources, but our relational resources as well. And structure brings in and allows for opportunities for communal participation. So violence is a public health problem that's been declared at the federal level. It's a public health problem. It's a problem, like I said, that's been around for a long time. And so our communities deserve a public health approach, something that can reach our entire community. It's widespread. So the public health approach has been used to deal with a lot of widespread issues, right? So it's not something that's new. It's been done and tested and proven to be effective. We've seen it with seatbelt laws. There might be some people here on the line that grew up at a time where there was no seatbelt law, but we learned over time. We tested out seatbelts. We saw that it actually led to reductions in injuries and fatalities, and then it became a law. We also have seen similar work done with smoking. We've learned the effects of smoking, and we've also learned the effects of secondhand smoking. And so over time, we started to implement clean air policies, and we've seen that people have done better. They've fared better. We've also seen it work, the public health approach, with things like workplace safety, right? How we provide opportunities for people with different abilities to be able to show up, and also keep our workplaces, our environments safe in a lot of different regards. And so this is not a novel approach. It's something that's tested. It's something that's sure. And like I said, our communities, our counties, our states, some of you are working at the state level, I saw, deserve that kind of approach. And so the public health approach has 4 steps, just 4. We define the problem, we identify the risk and protective factors, we develop and test prevention strategies, and we ensure widespread adoption. So for the remainder of my time with you today, I'm going to walk us through the public health approach and just how I am as a presenter. I'm really interactive. I'm be asking you to put stuff in the chat. I want to make sure that I'm hitting different learning styles. And so please be engaged. Okay, if you have lunch too, that's fine. Just save some for me. But I want to make sure that we're engaging and we're learning, and that that time that I so value that you've given up, that you get out what you get out of this, what you need. Okay, so let's start with step 1, define the problem. So when we're defining the problem, there are 5 things that we need to be thinking about: the who, the what, the when, the where, and the how. So who, yes, you'll have access to these slides. I think I just made a promise. I don't know, but yes, you'll have access to slides. Who is doing the behavior? What is happening? When is it happening? Where is it happening? And how is it happening? Right? The who, the what, the when, the where, and the how. So I'm going to talk you through a scenario, and then we're going to use the chat feature, and I'm going to hear from you guys. So I'm going to read this verbatim. So your office, yes, your office has received multiple reports of vandalism in the past week. Most reports mention a bunch of teenagers and young guys at different places in town, and they have spray cans. All reports state that the crime, them spraying, them tagging different places, occurs between 10 a.m. and 2 p.m. Okay, so you contact 2 colleagues for more information. You're trying to figure things out. One colleague works in your local department of public health, and the other one is a high school counselor that is shared across 3 local high schools. They both report to you that there's been a recent increase in school suspensions, and they share their data with you. You read the data report and find that there's been an increase in suspensions among self-identified Black and brown high school males in your county. You then contact another colleague in law enforcement. You're trying to figure things out. They report that some of their officers have had to stop some kids from spraying a local grocery store last Friday. The officers on the scene found out that they were high school students who had been suspended. They called their parents as a warning, but then they let them go. All right, so I want to make sure that I have this up. Okay. So tell me in the chat, who is doing the behavior? Who is doing the behavior? Really quickly. Give me 1 or 2 words. Who's doing the behavior? The young men. Okay, thanks. Teenage boys. Yeah. The teens, legend. Yeah. Students. Yeah. The young men. Great. What is happening? Students. I'm still saying, yeah. What's happening? Young men. Yeah. What's happening? Expressing themselves negatively. Okay. What's happening? They're trying to tag. Yeah. What's happening? Tagging property. Okay. Great. Spray painting. Great. When is it happening? Between school hours. Okay. Yeah. 10 to 2. Yeah. Okay. Okay. 10 to 2. Thank you, Tanika. Okay. Where is it happening? Thank you, Uriah. Where is it happening? Okay. Grocery balls, businesses. Okay. Where is it happening? Local business. Okay. Throughout the communities. Thank you, Dr. Bethia. Great. Buildings community. Thank you, Karen. How is it happening? How is it happening? Mm-hmm. What is leading to it happening? Unsupervised. Thanks, Tamika. Yeah. What's leading to it happening? Immediately that you know. Not digging too deep to surface level. They're finding empty spaces. Yeah. Being fine. Bored. Okay. Unsupervised. Bored. Yeah. Boredom. Okay. Okay. 1 or 2 more. How's it happening? Bored. Yeah. Lack of parenting. Okay. Lack of eyes in the street. Seeing attention. Community. Yeah. Looks good, Melissa. Okay. So here's some thoughts I have. You guys already have it. Lack of attention. I see it, Serena. Thank you. So we know that they're high school boys, right? Like we had reports to our office. We talked with 3 of our colleagues, all in different spaces, public health, school, law enforcement. We figured out, we verified that different people are seeing, different people are experiencing things, and that they're high school boys. They're spraying, tagging buildings. We know the time. We know that they're different places around town. And we suspect that they are suspended or they don't have adult supervision, as you guys pointed out. Thank you so much. You have defined the problem. That is step 1. This is very important because there's a thing called scope creep. There's a thing that allows you to go beyond what's more immediate. So getting very granular about the problem in a very simplistic way, something that you can have on paper and hand to other people in your department or in a neighboring department is going to be very important. So you're finding a problem. Step 2, you're already done with step 1. Step 2 is identifying risk and protective factors. So a risk factor is anything that increases the likelihood of a bad thing happening. So if I don't brush my teeth for a while, I might increase the likelihood or my risk of getting some kind of bad breath. I was going to say a cavity first, but bad breath as well. Something that risk factors or anything increase the likelihood of a bad thing happening. A protective factor are things that protect you from a negative thing happening. In other words, it decreases your risk, right? So maybe mouthwash in that example with all the different things that's supposed to do. Clearly, I'm not in the dental area, but all the things that's supposed to do should, in theory, protect me from a lot of different negative oral hygiene issues. One thing that I will say, because this comes up a lot in our trainings and different conversations, is that risk factors and protective factors can be a social determinant of health. I don't have a Venn diagram for you, but if you think about all like the circles overlapping, but it can be a social determinant of health, like housing insecurity. We can also describe a risk or protective factor as a root cause. So when people are talking about root causes of things, they're likely talking about a risk or protective factor. But one thing to really point out is that a risk factor and a protective factor are evidence-based, meaning that we don't just call things out. There is something in the research or literature that actually makes that connection, and I'll show you an example of it for my visual folks in a moment. The other thing to emphasize is that risk factors and protective factors tell us our why. So whereas in step one, we figure out the who, what, where, when, and how. Sorry for that typo. In step two, identifying the risk factors tells us the why, the root cause, what's really going on down below. So here is a visual that myself and some of my colleagues put together. This is focused on suicide and adverse childhood experiences, but it's the same concept. There's a factor, right? So I think hopefully you're seeing my arrow. I'm highlighting social isolation and lack of social support as like a factor. And we know from research, we know that like if you go Google Scholar right now, and you type in social isolation and suicide, you're going to find evidence there that there's a link. If you type in social isolation and child maltreatment, you're going to find evidence there that there's a link. So the risk and protective factors that you're identifying in step two, we want to make sure that there's evidence behind it and not just a gut reaction. Not saying there's anything wrong with your gut, but we want to make sure before we go on to our third step that we know that there's a connection. So how do you identify risk protective factors? Well, as Director Scott mentioned earlier, if you're in the community violence prevention space, use your state office as a resource. They're there to provide technical assistance. They're providing these trainings and other things like that. So they want you to be successful. And so you can use them as a resource. You can also reference the Connecting Dots publication. We're not able to put it in the chat right now, but it is available online, and the Office of Violence Prevention will email it out after this presentation. You can also use Google Scholar, as I was just mentioning before. If it were me, this is literally what I would type in. Parentheses or open parentheses, can't remember what it's called, risk factor or protective factor, and it's important there's capitalized, social determinant or root cause, close, and then put in the violence type. If it's domestic violence, if it's suicide, if it's community violence, put that in here. That's literally how I would search. And then you're going to find all these different brief articles or full-length articles that will give you more information and what they found. If you don't feel like doing this search, you could provide an internship or practicum opportunity to someone who can do the search for you. And then another option could be connecting with a local or state expert in your violence topic. So whether that's going to a university, going to a community-based organization or a coalition, there's folks in your area that are going to know, in your geographic area, they're going to know more about those risk protective factors. They might even have funding to do work on it. All right, so you don't have research in your hand right now, but I'm just kind of curious. What do you think could be a root cause of increased suspensions of Black and Brown high school males? In the chat. It's not a right or wrong thing. I'm just curious. And there's no answer after this slide. Culturally misunderstood, stereotype, thank you. Discrimination, thank you. Hiring of younger teachers, thank you. Racially motivated, thank you. Economic challenges, racism, discrimination, thank you, thank you, thank you. Cultural event, okay, thank you. Yeah, and finding out the why, yeah. Thank you so much. I appreciate it. I really appreciate it. Trauma, unresolved trauma, thank you, thank you, thank you. You guys are touching my heart. Thank you, Aiden. I think is how you pronounce your name. Parents Force, thank you, thank you. A lot of those things I have actually seen in literature. In some of the systems work that I do with counties, as Director Scott was mentioning, we do see those things come up quite a bit, and suspensions has actually been for Black and Brown high school meals has actually been a focal point for some of the counties here in North Carolina. So some of those things have been, yes, Catherine, poverty, root causes that we are tackling right now. So great, like you have done step 1 and 2. You have done step 1 and 2 of the approach. So I hope you feel comfortable. Demetria, you can't hear anything? I refer you to my wonderful colleagues at OVP. Maybe they can help you figure that out because I'm not sure. I'm not a WebEx person, so I can't help you. But I'm hoping they can. But this is recorded. So going on to, great, I'm glad. All right, going on to step 3, we want to develop and test prevention strategies. Okay, so here's what I want to say. Yes, that's true, collective, several issues. There are ways that we've always done things that maybe our predecessor who was in a role before us did and maybe handed off to us, or we've done strategies that maybe the community wants or so-and-so like gatekeeper influencer in the community wants. And I'm not saying that there's anything necessarily wrong with that because I don't have data. So I can't say there's something wrong with that. What I can say is that this step 3, is really, really important step. It helps us know what is actually working. So we want to know what is working and who it's working for, because not all strategies are created equal, meaning not every intervention works for everybody. Not because it works for Buncombe County means it's going to work for New Hanover County or another county, right? So not every intervention works for everyone. And interventions need to be tailored, tested, evaluated. So there's nothing wrong with a strategy that people like, that you use. Is it bringing about the changes that you intend, or are we doing things because we've always done it and we're comfortable and people know us for it? So I'm going to challenge you a little bit. So when we're developing and testing prevention strategies, our first step is to select intervention. So it could be, and I have 3 things here after Kanye, I have 3 things here. First could be we're searching online for existing strategies. So again, thinking back to that Google search that I mentioned before. So let's say instead of searching for root causes, you're saying intervention strategy and domestic violence, intervention strategy and suicide, whatever the violence area that you're interested in. You're just looking for strategy. Again, it's a great way to pull in students and other volunteers to help you look. Or you can ask experts in, it have to be in your geographic area, but ask experts in that violence type area, or if you want to intervene on the risk protective factor, you can ask experts who work in that area, in the risk protective factor area, for intervention strategies, and I'll tell you why that might be useful in a moment. Or you can have a homegrown option. So there's 3 ways that you can figure out strategies, but either way, they need to be tested. They need to be tested. And when I say tested, we need to start off pilot testing, thank you, with a small group of people. So thinking back to the high school suspension option or a scenario, when we find a strategy, we don't want to promise the world. We're not going to the school board. We're not, saying we're going to fix all the 13 high schools in the county. We're not going to the principal and asking to reform the whole high school. We're going to select a grade in the high school. We're going to test out with small group people. We're not going to do the other things, going to the school board or telling the principal we want to change the whole high school, because we don't have evidence yet. And we don't want to promise something that we don't know we can deliver on, because then that lessens our buy-in, that lessens our rapport. We want to be confident and know that we're able to change things. So we're going to pilot test it. And then after we've implemented or while we're implementing, we're going to evaluate. So we're going to use a mixture of qualitative, quantitative questions. For time, I'm keeping some things a little high level here, but we want to make sure it works. So after we know that our strategy works, then we go to step 4 and we test it with a larger group. So could be an opportunity where you go to all grades in high school. We're still not getting to the whole county yet. We're just going to the whole high school. And because we want to make sure, did the pilot work because of just the people in the pilot, or did it work because the strategy worked? And we don't know that until we test it with a slightly larger audience. If it still works, if you still get favorable results after step 5, then it's likely you have a intervention that actually changes things and makes things better. And then we get to widespread adoption. So I love this video. Hopefully everyone here has seen this. But the point here is you don't show up to Thanksgiving dinner just not testing things out yet. Like, I want baked mac and cheese that's been tested and tried. People know it's good before you get to Thanksgiving dinner. You know what I mean? Like, I don't try things out on me at Thanksgiving. I don't want a new recipe. I want to know that something that's good, that other people have tried it, they don't have food poisoning. Thank you, Tristan, for agreeing with me. And, like it's good. Thank you, Gerald. It's good, right? So don't try things out at Thanksgiving. So now that you know that works with the whole high school, for example, now you want to disseminate it to larger audience. You want to tell your stakeholders, your funders, hey, we have something that we think works. Hey, high school, another high school, this worked with this high school. We want to try it out with yours, right? And then you start to roll it out to a slightly larger audience. Now here's my pro tip. Incrementally roll out the strategy. I know we're excited because it worked with high school A, but still I would urge you not to roll it out to all, for example, 13 high schools. I would say go to high school B and try it out there because you still want to make sure it didn't work with high school. It didn't just work in high school A because there's something unique about high school A, right? You want to make sure that it can work in both high schools before you go to the school board and make a pitch and say, hey, we found this effective. We want to roll it out. The other thing I would say, going down to this point, is make sure all along the way that you're doing evaluation and quality improvement. So as you would have seen on a previous slide, make sure you have an evaluator on board. Even if there's, whether it's working with someone at a local community college or university, or making sure one of your staff members are trained up. And I know that's hard because some of us are in very small organizations, or there's like one of us doing multiple jobs. But as you can, it's going to be so important to invest in evaluation. So if that's doing a LinkedIn training, a Coursera training for free, like make sure that you're getting the skills you need in evaluation, right? For our communities, right? Our communities need this. They need something that works. They need to have confidence in us and our work. Because here's an example. I am very grateful Google looks, well, there you go. There's Nathaniel. All right, there you go. There you go. Look at that plug. I like it. Connections. We want to make sure that our stuff isn't outdated. As systems change, as policies change, as different things move around, we want to make sure that we are up to date, that we're continuing our quality improvement. And I have a minute left, but just really quickly, maybe one or two people. Why may our intervention to reduce high school suspensions among Black and brown males work with one school but not with another? Tell me really quickly in chat. I don't want to get in trouble with Director Scott. So click in the chat. Different areas, buy-in. Efficacy of delivery of intervention. Yes, Crystal. Race ratios. Yeah. One or two more. Staff ratios. I missed one coming in. Different approaches by school. Yes. yes, how people are implementing our stuff makes the difference. Thank you. Thank you so much. I am at time. I know this was just an introduction. I know we're about to go into questions, so I'm happy to take that and even questions after. This is some of the resources mentioned. I think Kenla was able to put the first resource in. I'm not sure, but um, I just want to say thank you for your time, and I'm going to stop sharing, Desiree, and just be open for questions.
Yeah, thank you so much, Dr. Young. Yes, this is an opportunity to do a Q&A. So if you all could list your questions that you have within the Q&A section or the chat now because the primary presentation is over, and then we can get that going.
Thank you, Gerald. It's very kind. Thank you, Sue Ann. And I think, Desiree, I can only see the chat, so if something comes through the Q&A, if you could let me know.
Yes.
Grace, oh, thank you. Grace, I'm not familiar with Baltimore's model. If you could tell me a little bit about that. I don't think you can come off mute, so if you can tell me in the chat. Or maybe, I don't know if OVP is familiar.
I don't have additional context on the Baltimore's model. So while Grace is providing more context, we do have one additional question in the Q&A. And so this one is, as a former educator, how do you stand regarding holding parents more accountable?
Mm-hmm. Um, so there is, if you, I don't know if it's just it seems like a general question. Um, what I would say, and this is maybe coming from my systems hat, I'm always thinking about how everything is connected, right? And so there are different factors that are going to lead to um, why we might perceive parents as not being accountable, right? Whether or not they're stressed because of like things going on in their home or maybe things going on at work or, different hats that they have to wear. I would want to do a deeper dive into that area and also hold a parent meeting. And so for me, my approach, and I apologize, I forgot the name of the person asking the question, is always to engage the people that I want to get on board with what we're doing, but also be open to changing or shifting things. So I'm not a person, and I was taught this in my master's class, we don't build something and expect people to come. Like we bring people into the conversation. I'm not saying you're doing this, I'm just saying like my approach. We bring people in the conversation, we get at the underlying issues, like what is driving parents not being accountable or not showing up or not responding to things on time. And then we engage with the community to see how we can help that. So like, let's say, for example, parents are stretched, they're each working multiple jobs or one's working multiple jobs, and they just can't be a part of it. Then I would want to be engaging with some of my county or community level resources to see how we can make, and also the school system to see how we can help parents in different ways so that their burden is lessened so that they can. So I don't want to just ask them to do something, although it's important, right? But also keeping a roof over their head is important, right? So I want to just ask people to do something without also trying to make an effort to help them, if that makes sense. Oh, thank you, Scott. Thanks, Grace. So I am generally familiar with the cure of violence model, but I'm not intimately familiar with it. So unfortunately, Grace, that's not something that I can speak to generally. I don't know if you are thinking about like the process for what went into like developing it or um, uh, yeah, but I don't have an intimate level of detail, so unfortunately I can't comment on that. Preventing ongoing. And you tell me when I need to stop, OVP. What role do you feel research contribute to preventing ongoing discrimination? What role do they contribute to it? No, preventing, sorry. And thanks, Grace. So, I think there's a lot of ways that research can contribute to preventing. So how we conduct our research is very subjective, whether it's qualitative or quantitative. I'm one of those people that believes that they're both valuable, and there's subjectivity in both of them. So how we develop and design our research, the questions that we ask, the way in which we're asking questions, the way in which we're delivering questions, all that makes a difference. In the data that we gather and how we're who and how we're sharing that data. And so for me, I've always been very communal oriented in my research. And so I get people on board usually from the very beginning. Like I'm working with different groups and saying, hey, this is an area. There's a funding opportunity. I think it will help us advance work in this area. Yes, they know as a researcher, there's going to have to be some fancy statistics and things I need to do on the side, just because of like where I sit. But I invite people into the conversation. For those that, and that's just my approach in general. Um, but how we're communicating and how we're explaining the findings that we have make all the difference. Part of it, and I think this is more like public health, we have a lot of training on discrimination and equity and what have you, but that's not every other field. So sometimes we can explain a phenomenon, but not be thoughtful about the stereotypes that we're perpetuating by doing that as well. So there's a lot of work to be done there, Jonathan. Yes, Tristan, thank you. I'm building integrating. I think I believe so. I don't know if it's Kara, please correct me. Um, but yes, that's a lot of the work that I do in systems thinking builds in that intersectionality. But it's definitely valuable. It's important, is I guess what I should say. Just like what I was talking about earlier, not every intervention is going to work for everybody. Part of that, and that's what you're getting at, is there's intersectionality to it. I'm sorry, I didn't defer to you, Desiree. I don't know if there's anything else in the Q&A. I just was.
No, you're okay. Yeah, I was watching you read those questions. We don't have any more in the Q&A. We have time for one more question. So if someone has additional questions, please put that in the chat or the Q&A so we can answer that for you.
And maybe can I assign homework being like watching that video? I can't remember her name. Oh my gosh, about Thanksgiving dinner. But that'll be like the one homework assignment. I think that'll really drive home the point of testing things out.
Absolutely.
Okay.
Okay, I'm not seeing anything else come through. There will be an opportunity to ask additional questions within our post survey as well. So if there's something that comes up, please feel free to put that in our post survey as well, and we can make sure we answer those questions for you. Thank you again, Dr. Young, for your presentation. We really appreciate it. That was really insightful and incredibly useful information, and we're really excited that you were able to join us today. I just want to close out with a couple of things. So for our office, we wanted to share with you all that we wanted to offer a few ways for you all to stay connected with us. So please visit our website. We're regularly updating that to make sure that we're providing resources and other learning opportunities for you all regarding violence prevention and community violence specifically. We will be having another webinar like this one in June, so that's really exciting. We will be connecting with those who are on our listserv and following us on social media and letting you all know when those dates specifically, or when that date specifically is and what the content will be. So please sign up for our listserv on our website if you haven't already, so you can stay in touch with us. And we will also be sending out our post survey. So please provide us as much feedback as you can, as this was our first webinar. We welcome all the feedback and ways that we can improve and provide meaningful content for you all. And on that note, thank you all so much for joining us today, and we'll see you soon.